So we'll go ahead and get started. Um, Thank you all for joining us this afternoon. And if you joined us yesterday for part one, welcome back for part two. If this is your first time joining us, we'll walk through and do introductions and then certainly walk through our methodology and share with you all the information that we discovered over this past fall through our community status assessment. But we'll go ahead and get started. I want to introduce our team who was part of this process and helped collect a lot of the data information and work through reaching out to a lot of our community partners and community members. But Jamie and Haley are our two public health systems analysts. Giselle is our health planner. Lisa is our chronic disease prevention specialist. And Ari is our CDC public health associate. And these five members of our team make up our entire group that works on our community health assessment and improvement planning process that we'll walk through. Today we'll walk through our methods. Part two will describe the information that we found in regards to housing, mobility, community safety, finance, and then we'll touch base on our next steps throughout our process for our community health assessment for Johnson County. But again, what we described yesterday, we'll walk through again, but Healthy Joke is what we refer to or call our county-wide community health assessment and community health improvement plan effort here in Johnson County. It's largely supported by Johnson County Public Health. It is part of our mandate through Iowa Code, and we've got a core committee that consists of several community partners that help guide our direction and our planning efforts throughout the entire process. Typically is roughly about 5 years from the beginning of assessing our community, forming a core committee, looking at and analyzing the data, going forward to identifying priorities with our community members and partners, and then work towards improvement planning, whether that's development of subcommittees within the community. But overall, our goal is to look at and find identify the highest priority health needs in our community and strive and work towards working with our partners to address those as best as possible. Our assessment process follows the National Association for County and City Health Officials framework that we refer to as MAP, which stands for Mobilizing for Action Through Planning and Partnerships framework. And for the most part, that is a community-driven strategic planning process for community health improvement planning. The 2022 Johnson County Community Status Assessment aims to describe the community in a quantitative way by measuring demographics, health status, and other social determinants of health so that we can identify other existing inequities. Then a part of this process is sharing the information with you all. But next, I'll pass it to Jamie to describe our methods and the design and distribution of our survey.
Thank you, Sam. Yes, so many of our survey questions were expanded from the behavioral risk factor surveillance system data that we received from the state. We really took a look at areas of interest and more concerning trends that we wanted to ask the community about. Community partner input was also key as we asked partners what they wanted to know about Johnson County in general. And then finally, we took a few questions from the Robert Wood Johnson Foundation's survey and specifically took kind of neighborhood safety and finance questions from that, which we'll touch on later. Overall, we really tried to ask why and expand on barriers to get to the root of issues as best we could. So our survey was available online via Qualtrics from September 22nd to November 19th of last year, so open just shy of 2 months. Distribution of the survey happened in a variety of ways. We had tablets, posters with QR codes. It was posted on our website, social media pages. We had emails out to partners with the links to the surveys and asked them to share word of mouth. We had, I mentioned partner sites too with tablets. So we had 4 partner sites that helped us distribute the survey on site, and we actually had some help with the University of Iowa College of Public Health Strike Force student team. So those students helped take those tablets out on site and just asked folks as they came through the doors at Community Food Pantry, North Liberty Library, Center for Worker Justice, and the Free Medical Clinic. So we got some information from those areas. And then we, the data that we collected was immediately compiled into a dashboard through Qualtrics. The analysis was also done through Qualtrics. As mentioned earlier, with the partner sites collecting data, we were able to give them access to the data that they collected through the dashboard. So they received de-identified client data, and then we received that population health data. So it was really great to be able to pair up that effort together. And talking with partners from the prior assessments, we've recognized there's a low capacity for a lot of nonprofits and other area partners to collect data, so client data. So being able to help them with this was great so that they could kind of get an insight into the health of the folks that they serve. Survey responses of less than 18% completion were excluded, just as that accounted for demographic questions and no other specific health questions that we were interested in. So we excluded those. So we got about 726 respondents that completed the assessment, which for Johnson County had a 95% confidence interval, yields a margin of error of about like 4%. So we feel like this is a pretty good representative sample of Johnson County. Data was then disaggregated by a lot of demographic factors that you'll see later on in this assessment, but also in the full report itself. So disaggregated by race, ethnicity, education, sex, gender, age, socioeconomic status, etc. Counts less than 6 were also excluded and not shown just for anonymity. And I will mention that our staff were really happy to accommodate any data requests for certain values if it's not shown in the report. So feel free to reach out to us anytime. We will have an email at the end of the presentation too, but it's just healthyjoko@johnsoncountyiowa.gov. And I will throw that in the chat, but I'm going to hand it off now to Lisa to discuss the housing section of the assessment.
Thanks, Jamie. Yeah, so the first section we'll start with today is housing. And housing is a major social determinant of health from a variety of different angles. Just to name a few, the physical conditions of housing, the location of where you live and accessibility of resources in your neighborhood, the stability of your living situation, and even the mental health impacts of how comfortable or how safe your living space and neighborhood are, as well as the financial impact or cost burden of housing, which Jamie will talk more about at the end of this section also. So we asked our survey respondents first if they owned their home, rented, or had another arrangement. And we found that 64% owned their home, 33% rented, and 4% reported another arrangement, which might have been owning a mobile home but paying lot rent, or living in student housing, or not having a permanent home. The bar chart on the bottom right breaks this down by age and shows that younger respondents were more likely to rent and older respondents were more likely to own their homes. And this isn't shown on the slide, but we also saw a pretty consistent association where the higher the reported household income was, the higher likelihood of home ownership also was. Our survey sample had a slightly greater proportion of homeowners than the overall Johnson County population. And we had, I think, an interesting trend in responses actually about the cost of rent. The renters in our survey reported a lower median cost of rent than what the census shows for Johnson County, but at the same time, the total number of persons per household reported in our sample was a little bit higher than in the census. But from the data that we collected, the average monthly cost of rent was $792, and the average monthly housing payment for homeowners was $1,330. Oh, I'm so sorry. The previous slide. Next, we asked respondents to rate their overall housing quality as excellent, very good, good, fair, or poor. And when we compare responses in this top figure, we can see that home ownership was definitely associated with improved housing quality. And then the bottom figure divides responses by household income and also shows a pretty noticeable trend that quality of housing increases as household income increases. Additionally, the highest average quality of housing was reported by white respondents, while the lowest average quality of housing was reported by Hispanic or Latino, Latina, or Latinx respondents. 104 of our survey participants answered yes to a question about whether they had difficulty affording their housing expenses. So this subset of participants was then asked if they had ever experienced having their utilities shut off while living in Johnson County. So about half of these folks, 50 respondents, reported that they had experienced a water shutoff, electricity shutoff, or both. And 35 of these respondents went on to tell us how long it took and how much they ended having to pay for their utilities to be turned back on. Their responses showed an average of 15 days and $221 to restart their utility services. Next, we had 18 respondents report that they experienced an eviction while living in Johnson County. And there was a strikingly disproportionate eviction rate when we separated these responses by race and ethnicity. The bar chart on the left shows the eviction rates of respondents by race or ethnicity. So for white respondents, 2% had been evicted and 1% had an eviction filed, but did not ultimately have to leave their home. But among Black respondents, 13% had been evicted. And folks also generally reported lower housing quality in their new home after an eviction, and most agreed that their eviction did result in difficulties getting to work or school. And next we'll have Jamie talk about housing cost burden.
Thank you, Lisa. Yes, housing cost burden is generally accepted as being about 30% or more of income spent on housing per month. Extreme housing cost burden is approximately 50% or more of income spent on housing per month. And so we really tried to look into this based on the self-reported data that we received. So we looked at self-reported household income and then self-reported mortgage or rent costs. With these values, we saw higher housing cost burden for renters compared to homeowners in general. So for example, 43 of the 321 respondents, or about 13% of homeowners, reported spending about 30% or more of their income on housing per month, while 91 of 157, or approximately 58% of renters report spending 30% or more of their income on housing per month. Table H.7 shows the average and median costs of housing cost burden for zip code. And we see zip code 52317, so that's more North Liberty, as the highest percentage of income spent on housing for renters. The median's a little bit lower at 34.1%, but lower medians are pretty much due to outliers in the data. We tried to get rid of those as best we could, but some people reportedly are paying much more in rent compared to reported income. But due to this data being self-reported, it's expected we would have some variance here. And with that, I will hand it off to Ari to talk about mobility.
Thank you, Jamie. During the mobility section of the assessment, we were seeking to understand the intersection between health and the built environment. Next slide, please. 91% of our respondents stated that they have access to at least one vehicle, and using census data, we found that 7% of Johnson County households have no access to any vehicle. Sorry about that. I didn't know I put transitions in this slide. But yes, and this bottom table M.2 is our census data. Next slide. Furthermore, we see that the percentage of households without access to a vehicle is larger if that household also rents. as compared to those that own their home. From our sample, there are 15% of renter-occupied households with no vehicles and 2% owner-occupied households. With this information, we start to look at what types of barriers Johnson County residents face without having a vehicle in their day-to-day lives. And in this slide, we're looking at transportation and the barriers that community members face due to inadequate transportation. So 25% of respondents state public transportation schedules not fitting their needs. 22% faced difficulty getting to work or school. 15% faced difficulty getting to medical appointments due to inadequate transportation. Additionally, respondents were able to write in other barriers they face. Some of the comments included unsafe cycling infrastructure, changed bus routes, and some bus routes not being available in their city or being limited to certain cities. When we look at this transportation data and we disaggregate it by race and ethnicity, we see that Black, African American, and Hispanic or Latino, Latina, Latinx respondents had higher percentages of difficulties getting to work or school because of inadequate transportation as compared to white respondents. When sharing this information with Johnson County's mobility coordinator, we also looked at transportation data disaggregated by age, and our findings showed that the most selected barriers due to inadequate transportation were difficulty getting to school or work and public transportation schedules not fitting the rider's needs. And for safety, we measured the safety of neighborhoods in Johnson County by asking the question, how safe do you feel walking in your neighborhood at night? 58% of respondents described feeling safe, 25% felt extremely safe, 15% felt unsafe, and then 2% felt extremely unsafe. Among those that felt safe, we broke it down by race and ethnicity and also by respondents that identified as LGBTQ. Next, thank you. Although respondents described feeling safe in their neighborhoods, there are significant differences in the percentages by safety by zip code. So in this first column, it's 52241, which is Coralville, 52240, 52245, and 52246 are Iowa City zip codes. And then 52317 is the North Liberty zip code. North Liberty had the highest percentage of respondents that felt extremely safe, 63%, which was 33%. 63% of respondents from Coralville described their neighborhood as safe, and 21% of respondents in the zip code 52240, which was Iowa City, felt unsafe in their neighborhood. Another measurement of safety is on the confidence of respondents being treated fairly by police in their neighborhood. We asked the question, if you had an interaction with police in your neighborhood, how confident are you that they would treat you fairly? Respondents had the option to choose between very confident, somewhat confident, not too confident, and not at all confident. This question was sampled from the personal experience of U.S. racial/ethnic minorities in today's difficult times that was conducted by the Robert Wood Johnson Foundation. It assesses current events like the economy, COVID-19, and political conflict and how it's affecting these minority groups. 46% of total respondents felt very confident in fair treatment by police. Although when we disaggregate that data by race and ethnicity, there are clear disparities. Among those that were very confident, Black or African Americans and Hispanic or Latino, Latina, Latinx percentages were lower than those of white respondents. And similarly, we see that their percentages of not too confident were higher than white respondents. And then furthermore, when we're comparing respondents that identified as LGBTQ+, 19% described not feeling too confident. Finally, looking at confidence and fair treatment by police by zip code, it shows that Coralville, which is 52241, and North Liberty, which is 52317, had overall higher percentages of very confident in fair treatment by police. Meanwhile, Iowa City's responses, which the zip codes are 52245, 5246, and 52240, varied between somewhat confident and not too confident. And this figure can help local government identify areas of improvement to build positive relationships between police and community members. And I'll now hand it off or back to Jamie.
Thank you. So we know finances are a big part of health that is really important. So without having adequate funds to afford housing, medical care, or prescriptions, healthy food, etc., taking care of health needs is really typically not someone's top priority. So we'll talk more about the relation we see in our data in a few slides. But with this, what we collected here, we see about 10%, a little under 10% are having serious problems paying rent or mortgage currently. About 14.3% report current problems affording medical care or prescriptions in Johnson County. A little under 10% here currently having serious problems affording food. And then about just under 20% report having currently having serious financial problems like paying credit card bills, loans, or other serious financial problems. We see disparities across the board really in every category. So by race, ethnicity, education status, just to name a few. The following slides like this one, I'll show more in-depth areas on this one. But for this graph here, we see current serious financial problems in every category, disaggregated by race. So we're specifically showing the Black or African American, white, Hispanic, or Latino, Latinx percentages here, as well as the overall percentage. Overall, we see other financial problems being the largest category where folks report having serious financial problems like paying credit cards, student loans, other loans, etc. So disaggregated here by race and ethnicity, we see more of a disparity. So about 57% of Black or African American respondents and 45% of Hispanic, Latino, Latina, Latinx respondents reporting other financial problems compared to about only 15% of white respondents. Next slide, please. So this chart here shows current serious financial problems by educational attainment. Overall, we see folks reporting education of 4 or more years of college faring better compared to those who report less education. So folks not completing high school report higher percentages of serious financial problems in almost every category compared to folks who completed grade 12 or their GED or more education. So often many higher paying jobs require some type of college education or many more years of experience, which is difficult to get without a college education. So jobs not requiring college education are typically lower paying, even minimum wage jobs. So seeing that a high percentage of folks likely working minimum wage jobs, they're having serious financial problems, paying rent or mortgage, affording medical care or prescriptions, and affording food is concerning, and likely increasing minimum wage might decrease this gap here. And then next slide, please. So we know financial situations can impact health. So if folks are struggling with finances, chances are mental and physical health will suffer as well. So respondents struggling with other serious financial problems like paying credit card bills, loans, etc., report about 5 or more days of poor mental health compared to folks not struggling with those other serious financial problems. And then respondents struggling with other serious financial problems were more likely to rate their overall health lower compared to those who are not struggling with other serious financial problems. So we asked also about how end of the month financial situation was for folks. So about 45% of respondents overall report not having enough or just having enough money to make ends meet by the end of the month. So figure F.7 shows this broken down by race. And this results really in a huge impact in folks' lives. Not having enough or just having enough money really dictates like food choices, seeing the doctor, especially if you don't have health insurance or you have a large copay, savings for future investments like a down payment on a home or for future emergencies. So really looking at previous housing data, we saw that the percentage of monthly income spent on housing is more for renters compared to homeowners. One reason might be that owning a home, while it does come with some extra costs like repairs, property taxes, etc., really might result in a lower monthly payment compared to renting. But without enough money by the end of the month, it is hard for folks to get ahead. So I think that's kind of the end of really our reporting here for our assessment. I think next we can really talk about next steps in our process and what we'll do with the data and kind of where we're at right now. So right now we're looking at reviewing healthcare access and quality in Johnson County. Really underway with this community context assessment where we're really asking folks to just talk with us about their experiences, providers and community members. And then in the summer, we'll really communicate some more data from everything that we've collected thus far. So we'll kind of pair everything together, as well as take in some secondary data sources and really get a good picture of what the community's health looks like. And then in the fall, we'll decide on our top health priorities. I think Sam mentioned earlier a little bit about that, but we'll have the community, kind of more community forums and kind of pose questions to the community on what issues we should focus on in our health improvement planning. And then in the winter, we'll kind of form some of those subcommittees to work on those priorities and really develop an action plan for next steps. But I think with that, we're really on the question and answer. We've kind of powered through. So if anyone has any questions, feel free. I'll actually just enable everyone to unmute. If you have questions, then feel free to unmute. Otherwise, you can go ahead and throw questions in the Q&A portion here, and then we'll get to those. I know we saw some of the same folks yesterday, and so some really great questions were asked yesterday too. So I appreciate all of you for joining us today.
Hey, Jamie, thank you so much for the great presentation. I'm curious to hear, because you're going to be presenting the results to the community, right? And have a community forum, have a discussion, make a decision. I just wondered from you guys' perspective as a team, what topics are kind of standing out that we might need to address?
Oh, that's a good question. I'm going to say all of it really stands out. It's really tough to hone in on some areas. We do have our core committee, which is kind of a group of community members that help guide us, I guess, in the process here, and really kind of let us know like areas they think we should really be looking into as well. And so that's kind of how we chose with this next assessment right now that we're doing is healthcare access and quality, to really focus on that. But yeah, there are just so many areas that especially this assessment uncovered too that we would really like to dive into a little more, and especially start health improvement planning. We're really excited and eager for that. But ultimately, yeah, we're just really looking at what those community forums will look like too, so that we can, we have our own ideas of what we would like to look into, but really it's really imperative that the community get on board with what we're doing too, so that just folks are motivated and excited for the health improvement side of it.
We got a question in the Q&A. Is there a comparison to previous outcomes? B, if you're wondering if the department has previous data that matches up with this, to some degree, but not, I would say it's really hard to compare for a couple of reasons. The questions are not exactly the same. And so it'd be very difficult for us to, I don't want to say transpose, but kind of draw a line between the two. There's also this large giant pandemic that kind of happened in between those 2 points. And so I think it's probably changed a lot of mentality and thought around a lot of these things. The other is, I just want to, and it's really a shout out to our team for doing such a phenomenal job. This process is so more robust than it has been in past years. And to put that in perspective, previously, before, right as I started here at Johnson County Public Health, it was really tasked with to the health planner at, I believe, around a 0.7 FTE and part of the community health manager at 0.3. So maybe a total 1 FTE total. And now, as everyone sees here, we have a team of 5 persons to really support this project in a variety of different ways. And so a lot of gratitude to our leadership and to the board for supporting that, but really hoping to demonstrate the vast, robust data that we're collecting now. The outreach that we're doing, as Jamie alluded to, our methods is far more robust. Previously, I believe the largest lesson learned from the 2015 assessment, and I know I mentioned a 5-year process, but obviously there's a couple years of delay there. That data collection occurred, I believe, over the end of the summer and fall, and primarily online. We saw that there was a very specific demographic, middle-aged, Caucasian, white females predominantly taking that survey. And so we're really working to be out in the community, be on site, and make sure that the technology that we're using to help us do better data collection and analysis is not a barrier. So that's where you also heard Jamie mention the partner sites that we're utilizing, and we're hoping to onboard other sites to help us with also the benefit of being able to provide them their site-specific information. So kudos to the team for really expanding the outreach that we're doing right now.
Yeah, I just want to add to that, phenomenal job, really, truly. I come from a planning background, and planning and public health really do go hand in hand. And that's really why I asked the question, is because, it's always good to show, before the pandemic, where we're at now. And now that I'm in this position, I have to answer a lot of questions as to, why are we spending so much? And I like to point to the data. I like to say, well, these are the cracks and the chasms that were exposed, and this is what we're working on. So I'm very proud to stand behind what's been done. And really, it was just a question as to, how you were always looking at, the outcomes, comparisons, what did we do differently, yada, yada, yada. But so I look forward to the, in 5 years, what that looks like, I guess. But I did have one thing, if it's okay, since I have unmuted now, you may regret this. But when we were talking about public safety, I noticed that it was really centered around policing. And I'm wondering if there are other models to utilize in terms of how people feel safe. I know there's a lot of data on policing, and certainly it's good to capture that. It's more of an added, are you feeling safe in your home? Are you feeling, those, because I think it just sort of buys into this narrative. Even quite frankly, I'll just be frank since I'm here, the cover sheet with the police, lights on it. I mean, it just signals, it just kind of reaffirms that the only way you can feel safe is if we're policing. And I don't know I think there's a lot of data out there that could really, that's questionable. And I know we're always striving to do more and to, kind of be different or whatever, but I don't know. I mean, I'm just kind of getting into this territory, but I just would love to see a little bit more nuance there. But also too, it was very focused on the cities. And of course, I understand it's just that we have a sheriff and I don't know how to speak to that. I often get told that the sheriff's office is different than the police department, and that people feel served differently, but I don't have any data to verify that. It's not like they have a survey that they give to families and people that they're putting in the back of a car. I mean, although maybe we should, I don't know. but anyway, just kind of wanted to put that out there, and it's really not a critique. It's just something that I, wanting to kind of say more, I guess. So anyway, but thank you so much.
If I could chime in here. There are some measures of community social capital measures that we could use. So those are the questions like, can you trust your neighbor? Do you feel like you can trust them? That kind of more of a broader general community perception of the community safety and unity type of things that we could potentially consider in the future research. Yeah, or data collection.
Yeah, absolutely. I really appreciate that feedback on that section too, and just that your perspective on that. It's really good to know, especially for future iterations of data collection too. It's like, do we like that metric? Do we not? Are there better ways to measure it? And yeah, absolutely, there are definitely better ways to measure all of that. I know we did look at domestic violence kind of info or questions too, but with that, it's tricky too, because if someone says, yes, we would love to, give them resources, but it's tough in a survey form too. I mean, ethically, it was just kind of a dilemma there as well. But yes, I think a lot of the origins of those questions really came from that one Robert Wood Johnson Foundation survey too, so we could kind of see nationally, I guess, how folks feel about that too, and see what, how it compares to the data we collected. But also it's community partner input too was kind of how we got that as well. But I do really appreciate that, your perspective on that. And yeah, that'll be an interesting area to measure maybe differently in the future too.
I came late, I'm sorry about that, and I didn't attend yesterday's seminar, so I'm not sure if this was discussed yesterday, but this is a question on the demographics, and I wanted to see, because perhaps you had some information about immigration status. We have some folks that probably collected some data from I don't know if you had those questions in there. And even though that could have been captured by the ethnicity, but not necessarily, of course, we assume that immigrants are usually people of certain ethnicities. That could have been captured by the variable on race there, but not necessarily always going to be the case. So the question is, did you make an attempt to gauge the effect of immigration status on health inequality? And then in any of the measures of health inequalities that you have, either mental health, days of mental health, or just feeling physically not good.
We did not ask about immigration status in our survey. And a lot of our thought process behind that was so that our survey respondents wouldn't feel uncomfortable necessarily, because that can be personal information that not everyone wants to disclose. And we didn't want that to be a barrier to completing the survey. But you're right, that is, information that would be important to have. And I understand the the necessity of having that information, but it was difficult for us to find a way to incorporate that in the survey, but also not have it feel like an invasion of privacy. Jamie, do you want to jump in if I'm missing anything there?
No, I think you really covered it. It was definitely an area where we did think of, and it would be great to have that data on too, just so we could really see what the picture of health looks like for those folks in our community. And so Possibly maybe future iterations, we could take a look, but we did really try to get good, I guess when we distributed the survey, we tried to really find some partner sites, encourage partner sites that serve specifically immigrant refugee families and folks in our community to have them take the survey. So we know that those voices are in this survey, just not specifically named out by that metric there. But that's
So
a great question.
So the population is in there implicitly, but we cannot be able to isolate just who they are and how severe the inequalities are among that population. And so the purpose, I believe, is to reduce those inequalities, and that is a major variable. And although we have other things to do with age, incomes, and other things, but you believe this population in Johnson County, we have about 4,000 immigrants and refugees. We do not know whether they are, what proportion of them is undocumented or documented, but usually a small proportion of that is undocumented. And those ones are usually much more economically depressed, given that they are not eligible for those health resources that we talk about, health insurance, ability to get Medicaid or Medicare, those things. So you, at some stage, you're going to make an attempt to reduce these inequalities. I can see you give us a timeline there, how you're going to attack this problem for the population. So the question is, how are you going to reach this population? And if during the sampling time, it is very difficult to get them. And at the moment, you do not have a way because of fear of interfering with that information of them, the fear that they are not going to be able to talk, given that they're afraid you might report them or something like that. They're not going to give you the right information on them. The question is, how are we going to help them? Do we have an approach, and how does the CBS, the national federal government data collectors, how do they deal with this issue out there? They have to, by federal standards. I think they cannot simply just say we ignore. They have to initiate some approaches. Are you going to work with the communities, different surveying techniques that are not maybe the Google type that I think, I don't know what type of survey you did. It could have been a Google way, or you just sent some questionnaires by mail. So how have you thought of, because this is a problem that is starting to confront a lot of us in policy, health policy things. Are you thinking of working with local immigrant groups? I'm an African and an immigrant, as you can see from my accent. We have African associations, Hispanic associations, and things like this. Have you made an attempt to coordinate and work with these groups so that in your samples, actually, you can be able to say, these are the surveys that we sent to these people, and they came from these organizations. You don't have to put all the details. You can hide some information and make them not anonymous. Yeah, so I believe that maybe we cannot simply just forget about them. There should be other approaches. Work with those migrant community and associations. And they know these people. They can probably do the survey among themselves because they are not afraid of talking with their own people. Yeah, they can say, well, we are trying to do a survey on this and this and this. So that even though they don't tell you whether they have the papers or not, but you are very sure that these are really immigrant communities, because you are certain that the data came from those groups, from the African Association, from the Indian Association, Chinese Pacific Association, something like that. Yeah. So I guess, yeah, in the next time, you can work out some proposals that allows you to reach these people through those organizations that they have. Yeah, that gives them confidence to talk to people that they know here. Because when you start helping those communities and you can't reach them in the data point, then at the point where I start helping with them with the resources and other things, it becomes very difficult. Yeah. Yeah, if you can't even sample them. Yeah. Yeah. How do you help somebody you don't know? Yeah. Yeah. So the only thing you're going to use is by race. You're not going to pick people, okay, you guys are Black. We have Blacks who are not immigrants. So, yes. And usually there are really big disparities between the Blacks who are immigrants and the ones who are not. Yeah, so that's just my worry. Yeah. And the other question I have is on the data, is it something that can be made available to the public? Let's say I have interest and I wanted to look at, okay, how was the data collected? Is this a data that I can use for any other thing I want to investigate? Yeah, I want to see maybe if there are some indicators of health inequalities that are either based on the places of residence. We have these disparities also based on location where you live and other things like that. Those economic, the Southern District in Johnson County, the other district, other thing. Is this something you can help us with? You map those ones for us. Yeah, because you guys probably are good in those scientific methods, GS stuff, and we can see. That's something we can just see. I can just see how severe is the health inequalities in the Southern District residents, yeah, things like that.
Absolutely. If I can try to address, I think I caught 3 questions. If I miss one, please let me know. I'll take the quickest one first. In terms of whether or the access to the data, absolutely. That's publicly available. And as the team mentioned early on, if there are other inquiries or questions about what we collected, please send those to us. We're happy to break that down as best as possible. We collected a vast amount of information. The report, I believe, totals somewhere around 100 some pages. So it's we're trying to do our best right now to condense as much as possible into about an hour, but please feel free to reach out to us about the information. I'm glad that you pointed out some of the gaps that we have with our survey, and I do want to point out a couple other portions that we are working on and have worked on in the past, because what you described is absolutely a gap that was in past efforts of the county health department, past efforts for community health assessments across the state and nation. And that's where, in the beginning, where we described the framework that we're using, it has 2 other assessments. One that we've completed, I believe, last spring. It's referred to as our community partners assessment, where we have reached out to our community partners that serve all parts of our community, all different sectors, whether it's healthcare, education, nonprofits, a whole spectrum. And Jamie and the rest of the team had reached out to probably upwards of 30 plus individuals at those organizations to get that information. The other portion, which I believe was a little bit alluded to right now, we are working on what is referred to as context. And that also helps what we're hoping to pair with the quantitative data, where we're getting the qualitative side of things, where we're looking at, and specifically at this moment, healthcare access, because that has been one of the larger themes that have come out throughout this entire process for us the past year and a half. And so we're looking at addressing really what those inequities are for different populations. So I do want to assure you that we are doing our best to work and reach out to our community partners that cover a lot of different populations, different sectors of our community, and appreciate the feedback.
Thank you.
Thank you. Oh, and it looks like Jamie has placed the links to both of those in the chat, so thank you, Jamie.
I just wanted to comment that I'm so already excited about your community forums, and I'm wondering, your strategies moving forward, having those community forums, and there's a way to specifically try to get to the communities that were underrepresented in a survey. If that's in your plans, do you have comments on that maybe?
Yeah, absolutely. And then if the rest of the team wants to jump in and share some other insight into the planning that we talked about, absolutely, there's a desire to go out into the community and really make these as available as possible. We know that from other past efforts and other different, we'll say, flavors of surveying in our community, there are points in time that have been difficult, whether it's seasonality, summer, et cetera, and certainly timeframes, whether it's during July where it's very hot, or if it's looking at morning or afternoon or evening. We're wanting to make sure that we are reaching people where they're at. And so our next steps will be looking at one, the vast variety of partners that we work with and community members to identify those. We've made strides to do that already. The other will be to reach out and look at what that scheduling would be and really finding folks where they're already at. Instead of us saying, hey, come to Johnson County Health and Human Services, we're wanting to really go to folks where they're already convening at, if they'll have us and everything. So that'll be other parts of our efforts going forward.
That sounds great. Thank you so much.
So Sam, I think you mentioned you were going to answer the 3 questions. Maybe I missed one of your answers on the geological, those spatial aspects of the results and the residents. Yeah. Can you say something a little bit more about that? Especially mapping that out for us to see, those who are interested in.
Absolutely. If that is, I mean, that's something that we could look at incorporating and finding ways to make sure that that does not cause a barrier or concern. I'm absolutely open to that. And that's, as Lisa mentioned, we wanted to be sure that in recognizing our positionality as a government agency, that we're assuring folks that this is solely for the purposes of improving health, but absolutely recognize that this pass, that's a missed opportunity to collect that. But as Jamie had mentioned, where we were working with community partners that specifically work with populations, whether immigrants or refugees, we're absolutely wanting to continue with that process so that we're capturing their voices in this.
There could be some indicators there in your data. I don't know. Did you ask about residents so that you go by the zip codes? Because you can group for us at a really broad high level. I don't know, at macro levels. I don't know. Just some indicators, like especially I'm worried about, you say I'm worried about safety, police, maybe fear of police. I wanted to say, where is that fear much more? If you get me some contours there, I want to see some hills and other things, you know, what I'm talking about. Yeah, I think you guys are research scientists. So if I wanted to see the south district, how bad are those hills or those red hotspots looks like, you know, like a heat map? If I was interested in, and I wanted to see, yeah, I don't know the names. I don't want to know the names. I just want to see where is that issue hot? Yeah, is it by resident status? And you know, the residents where people live goes by income groups and things like that. So I haven't looked at your report, and that's something I would be interested in. Maybe it's taking, but yeah, I see you're a team. I believe you're a team that can really do a lot. Yeah.
Yeah, that's a great question. With the mapping, we have explored mapping in other areas too. We did a heat vulnerability assessment actually last year. It's coming up on a year soon here, but we could look at zip code data based on what we collected here and kind of map it out a little bit. It just wouldn't give us, I guess, precise areas just because zip codes can be just so huge here. And then we have some zip codes with less respondents than we would really say as like, I guess you couldn't say exactly if it had such a low response rate that this area specifically has, you know, 15 days of poor mental health or something like that. It could be hard to draw those conclusions. But we could look at that. I know we haven't done that yet with the data we've collected, but we could definitely try to take a look and see some areas where we could try to map that out or estimate that. And then I'm just gonna send our email in the chat too for you because I think it might be nice. Maybe we could catch up to just a meeting of all of us. I know we're coming up on time here, but it would be great to just connect with you and see what we could do to work together.
All right.
Absolutely. And Jamie, I just wanted to follow up as well. If, you know, if this survey has not captured all the other information that you might be looking for, I do want to mention that with a larger team and our commitment to continuously assess, there will be other opportunities, and it may not be this specific status or health status survey that would be best fit. And absolutely happy to entertain other ways to, whether it's a survey, whether it's a community forum, a listening session. There are very specific needs or concerns. Absolutely committed to being able to be in the community at those meetings or group settings where we can collect that and really want to place the emphasis that qualitative data should have. This effort here was specifically for quantitative data, and there are a variety of ways that we can improve this, and then certainly look at other ways too. So if there is a very specific area, neighborhood, or a very specific question to be asked or to be discussed in terms of health, we're absolutely happy to have that conversation. So. We've got 3 minutes left until the hour, if there are any other questions. But appreciates everyone's time. I know that Jamie had placed our email in the contact for chat again. If anything else comes up as well as you're looking through the report or other information, please feel free to reach out to us.